friends, welcome to Ezinurse, where nursing education made easy. So in this session, mainly we'll be discussing about on the important and the repeated questions they are going to ask in the psychology. So when you're coming to the psychology, the mainly important questions they'll be asking like a long essay, short essay and the short answer. So when they're asking the question, read the questions properly, then you write your answer. Let's start the session. So first questions, it will be there like a what is the goal directed behavior? If they're asking the question like this, so you have to write like a goal directed behavior refers to the actions that purposefully taken to achieve a specific objective. So goal directed behavior, what is that? It refers to the actions that purposefully taken to achieve a specific objective or a outcome. So whatever you are going to do the specific objective, like you have planned to do some thing, so for that you have to set a particular objective or a outcome, it should be there for that particular reaching a goal. So this type of the behavior is driven by the motivation, planning or a decision making. So motivation, it is an internal drive or a external intensive. So internally as a person, when you are achieving a goal, it should be come from the internally from you, or it may be externally, that is someone is going to pushing to do the particular achieving a goal, or it will be like a planning. So when you are going to reach a goal, whatever you are having, so it should have proper planning, that is a developing strategy to achieve that particular goal should be there. Then action, so whatever done here planning, so on the basis of that you have to make the action, that is a step taken towards the achieving that particular goal. Then feedback, so it's the most evaluating progress and adjusting the actions as needed. So whatever the goal you have reached by the step by step, that is what action you have taken, it should be come up with the feedback. Then last is the outcome. So outcome is nothing but whatever that achievement will be there, it will be showing with the outcome, that is a achievement of that particular goal. So if they are asking that is what is goal directed behavior, you're supposed to write the goal directed behavior refers to the actions that are purposefully taken to achieve a specific objective or a outcome. Next, we will see the another question, that is enlist the role of nurse in handling a dependent personality. So suppose they are going to ask the question like this. So enlist means you have to make the list. The role of nurse. So role of nurse, what she will be taking in handling a dependent personality. So dependent personality patients, when they are admitted in a hospital, so what's the role of nurse? So you have to make the enlist of those things. So when you're coming to the enlist the role of nurse in handling the dependent personality, so these are the things you have to enlist, that is encouraging the independency, providing the emotional support, establishing the boundaries, promoting the self-esteem, along with that teaching coping skills. So these are the enlist you have to do as a nurse when they are asking with the particular question. So what's the role of the nurse in handling a dependent personality? So all these things you have to enlist when they are asking the question, that is enlist the role of the nurse in handling the dependent personality. So encourage independency. So when the patient is a dependent personality is there, you have to help the patient to develop the decision making skills is the most important. So they are not taking their own decision. So as a nurse who will be there, we have to help them to take their own decision skills, then along with that encouraging them. So we have to encourage them in every aspect, the day-to-day aspect, what the patient is going to do. So we have to encourage his skills and we have to motivate him. Next one is providing the emotional support. So when you're coming to the dependent personality patient is there, so when the patient will be there, that's a dependent personality, so we have to make that the balancing empathy with the encouragement for the patient to handle the changes, that is especially what the changes is going to happen in the day-to-day activities. So we have to make them handle in a independently. So that is what the providing the emotional support for the patient. Next one is the establishing the boundaries. So set a clear professional boundaries to prevent the patient to becoming a overly reliant on the nurse for the emotional or a decision making support. So we have to set a particular boundaries between the patient. Next one is a promoting self-esteem. So here what will happen, we have to promote the self-esteem of the patient, that is especially with the reinforce the patient's strength, provide the positive feedback is a most important. Then along with that, we have to teach them the coping skills. So especially what will happen with the dependent personality, they are not having any ability to do by themselves by the independently. So here we have to teach them the coping skills, educate the patient on a healthy coping mechanism, and along with that problem solving strategies, that is whatever the problems that is going to arrive in a day-to-day activities. So we have to teach them, that is how to solve the day-to-day problems, whatever the arises is going to happen, then they have to make the problem solving strategies to overcome that particular task. To manage their anxiety and the fear is a most important. So if they are asking the question like the enlist the role of nurse in handling the dependent personality, so you enlist this all the things, that is what the as a nurse who is going to take care of the patient who will be having a dependent personality, and explain them. Next question is, it will be asking like enumerate the method of the assessment of the emotional intelligence. So they will be asking like enumerate the method of assessment of the emotional intelligence. So when you coming to the emotional intelligence assessment, there will be different type of the emotional intelligence assessment it will be there. So under that we can able to see that is a self-report questionnaires. Next one is a performance based test, 360-degree feedback test, then behavioral observation, along with that interviews and the case studies. So these are the different type of the assessment of the emotional intelligence. First one is a self-report questionnaire. So self-report questionnaire. So what is that self-report questionnaire? So here what will happen, individual rate themselves on the emotional intelligence are related with the skills such as either it will be like a empathy, self-awareness, emotional regulation. So they have to make themselves with the assessment with the related with the self-awareness, then along with the emotional regulation, that is how the self-awareness is there, then emotional regulation with the day-to-day activities how they are going to do, that is a self-report questionnaire. But as an individual by themselves only they are going to do this test. Next one is a performance based test. Here what will happen, this test measures the individual ability to perceive, understand and manage the emotions. So we have to understand, that is how individual have their perceive the things, then how they are going to do the understanding the day-to-day activities, then how they are going to do the management of the emotion is a most important, that is what they are going to do with this performance based test. Next one is a 360-degree feedback. Here what will happen, this method collect the assessment of the individual's emotions. So individual emotions has the individuals who will be there, so they are going to take the collecting the individual emotional intelligence from the multiple sources, that is either it may be by the supervisor they are going to take, either with the colleagues, or it may be with the subordinates, by providing the well-rounded view of the emotional ability in the workplace. So in the workplace, by the colleagues, by the subordinates, they are going to collect the information to check with this 360-degree feedback test. So next one is a behavioral observation. Here what will happen, a trained observer assess the individual emotional intelligence by watching their interaction. So how an individual is going to interact with the another person persons, then their emotional responses, if anything has happened like a anxiety or a depression, how they are going to do the emotional response. Then problem solving ability, that is if any problem has arise, how he'll make his own strategies in problem solving ability in live and simulated setting. So this is how the behavioral observation they are going to do. Next one is the interview and the case studies. Here also there will be a structured or a semi-structured interview, that is explorer and individual emotional intelligence they are going to take by asking a describe it, like they'll be having a structured and the semi-structured questionnaire is how they'll be handling the emotional situation, focusing on the self-awareness, empathy, along with that relationship management. So this is how they are going to do the test, that is the interview and the case studies. So these are the different type of the assessment of the emotional intelligence, that is a self-report questionnaire is performance based test, 360-degree feedback and behavioral observation, then along with that interviews and the case studies. Next question we will see. So if they are asking the question like list out the 2 advantages of the self-empowerment, so you're supposed to write the increase the confident and the decision making skills, it will be better. So that is the increase confident. What will happen by doing a self-empowerment? Self-empowerment boost of the personal confidence and enabling the individual to take control about their decisions, actions, which enhances the self-esteem along with the sense of accomplishment. So this is what it will be increases the confidence. Next one is a better decision making. So when you are going to do the self-empowerment, what will happen? It will make your own better decision making by individual, by yourself. That is a empowerment has an individual tend to make more informed and the effective decision, that is especially with their abilities, take the responsibilities for the outcome, along with that more proactive in the problem solving skills. So this is what the better decision making. So if they are asking the question like list out the 2 advantages of the self empowerment, you are going to write increased self confidence and better decision making. Next one, if they are asking the question like amnesia. So what do you mean by this amnesia? Amnesia is a condition characterized by partial or a complete memory loss. Here what will happen? There is a partial or a complete memory loss, it will be there. Partial means either they are going to forget the few things whatever it has happened, like a partially that memory loss it will be there, or a completely memory loss that it may be happen for the person who is having a amnesia. It can be affect the ability to recall their past event, that is what we are going to call the retrograde amnesia, or maybe with the form of the new memories, that is what we are going to call the antegrowth amnesia. Amnesia is maybe result from the either it may be because of the brain injury, or it may be illness or a psychological trauma, or it may be because of it will be getting a substance abuse. So this is the whatever the causes it will be happening for the amnesia. So when you coming to the causes, what I said it will be because of the injury, stroke, or it may be a brain infection like the person who is having a meningitis or encephalitis, or emotional shock. It will be happen by losing their loved ones, or it may be because of their losing their job, whatever it may be. So that cause what is happened. So because of this there is a chance of getting a amnesia. Then types. So under that we can able to see there will be 2 types. There is a retrograde amnesia and the antegrowth amnesia. Retrograde amnesia, here what will happen? Retrograde amnesia, here inability to recall the memories that is from the before onset of the amnesia. So before onset of the amnesia, whatever that memory it will be there, the patient is going to lose. Next one is the antegrowth amnesia. Here what will happen? Inability to form a new memories after the set of the amnesia. So after that patient is having a amnesia, that patient can't able to make the new memories. So this is the what the 2 types of the amnesia, that is a retrograde amnesia and the antegrowth amnesia. Next, what are the symptoms? It will be there, the person who is having a amnesia. Usually there will be memory loss, that is either it may be a past or a that present, that patient can't able to recall the memories. Next is a confusion, it will be there. though the patient can't able to make the proper decision, so or they can't able to recall. Because of that, there will be a lot of confusion, will be there, difficulty in recalling a information or a personal history. So the own personal history, what the patient is having, where that patient was working, what's his name, what are the, who all are the friends, who all are be there, so the patient can't able to recall the information and the personal history of the patient. So these are the symptoms, usually it will be there. Next, the treatment. So what the treatment we are going to give for the patient who will be having amnesia? Usually there will be, depends upon the cause, either if it is a infection factor is that we have to treat the infection, that is with a proper antibiotic, or it may be injuries happen, we have to treat the patient in a proper way, but it may be along with including with the cognitive therapy. If the patient who is having a totally memory loss is there, so by that time we are going to give the cognitive therapy, along with that the rehabilitation. Then rehabilitation, we have to restore the health of the individual, that is what the patient who is having a problem at the present, so we are going to give with the proper cognitive therapy. Then along with that, addressing the whatever the problem situation, that is the underlying cause, what is there, we are going to treat with the medical condition. So the next question, it will be there like a, explain the role of the nurse in a vulnerable group. So vulnerable group means the people who are likely to be harmed. So example, when you take the like a children's, old age peoples, or a disability peoples, or it may be a chronically ill patient, who all are there, we are going to consider these are the persons will become under the vulnerable group. So what's the role of the nurse in the vulnerable group? So usually as a nurse who will be there, she will be taking a role as a advocacy, then health education she is going to give, cultural sensitive care she is going to give, along with that building a trusting relationship. Then she is going to make the coordinating care and the resources. First one is the advocacy. So advocacy, as a nurse she will be served as an advocate. So as a patient, when she is going to take care of the vulnerable group of the people, she act like a advocate for the vulnerable population, ensuring that they are receiving the appropriate healthcare services, resources and the support. So they are getting a proper service with the health services, then they are getting a proper resources, then along with that, so they are getting a proper support from the family, with the society, everything is there. So she act like a advocate in taking care of those persons. So next one is a health education. As a nurse who will be there, she will be providing a tailored health education to vulnerable individuals, so helping them to understand their condition. So what's the condition of the people, especially if the children are there or old age people are there, so they are going to understand what's the present situation, what's the illness factor is there, all those things, and make the informed decision. So this education that will be covers the preventive measures, that is by giving a medication management and providing a healthy lifestyle choices to improve their healthy outcome. Next one is she is taking care with the cultural sensitivity. So that is, as a nurse who will be there, so she will be providing a cultural competent care in crucial when working within the diverse population. Nurse must have aware of the culture, social, linguistic differences and the respect the patient belief, along with that practices and ensuring the care with the both respectful and the effective way of the care for the persons. Then she is acting like a building the trusting relationship, that is, as a nurse when she is going to work with the vulnerable group of the people, she act like a building a trusting relationship, that is, vulnerable individuals may distrust the healthcare system due to the past negative experiences. Because of that, the nurse plays a key role in establishing the trust through the empathy, communication, not judgmental attitude and consistent support with those persons, then which encourages the patient to seek care and addresses to the treatment of the care. Next one is coordinating the care and the resources. As a nurse who will be there, she will be acting like coordinating the care along with the resources. So whatever the care she is going to give, she will be coordinating with those persons with the vulnerable group, along with that resources from the way they are going to get, especially with the multidisciplinary care they are going to give, with the coordinating the comprehensive care for the vulnerable group, along with that connecting the patient with the social services, mental health support, housing assistance, then essential resources that addresses the both medical and the non-medical needs for the patients. Next question, if they has like to justify the role of nurse in reducing the frustration and the conflict among the sick individual. If they are asking the question like this, as you have to write the effective communication, emotional support, patient advocacy and the conflict resolution. First one is the effective communication. So as a nurse who will be there, she has to listen properly what the problem is there, what the conflict is there, then she has to make the proper solving skills. Then along with the, we have to give the emotional support. So as a nurse who will be there, she has to give the emotional support for the person, that is providing the empathetic care, helping the patient express their feeling and along with the fears. Then patient advocacy, the nurse has to advocate their patient needs and preference, ensuring that that is heard in their treatment plan. Then conflict resolution, so what the problem is that they have to do the resolution of the conflict. Then along with that, education and the information. So they, as a nurse who will be there, she has to give the proper education and the information for the patient. Then creating a therapeutic environment is the most important. Nurses, that is a contributing, climbing and the supporting environment in a healthcare setting. Then holistic care, as a nurse who will be there, along with the giving a therapeutic care, she has to give the spiritually, physically and the mentally support for the patient. So this is what role of nurse in taking care of the sick individual with the conflict and the frustration. Then the one more question they'll be asking, like describe the defense mechanism with the appropriate examples. So you know what's the meaning of the defense mechanism. So defense mechanism is like nothing but the psychological strategies that individual use to cope up with the anxiety and protect themselves with the for the emotional plan. So under that there is a different type of the defense mechanism we can come across, that is a denial, repression, projection and the rationalization. So denial, so usually what will happen, denial, refusing to accept the reality or a fact. So the person who will be having their refusers to accept the reality or the fact what has happened at the present situation. So for example, when you take a person who is having a heavy smoker or a deny that the smoking is harmful to health, but still that what will happen, the person will be having a insisting that fine, there will be some medical evidences, it will be there. Next one is a repression, so pushing uncomfortable thought or a feeling into the unconsciousness. So usually what will happen, for example, when in your childhood days whatever the trauma has happened, you are not remembering when you are grown up, because it is a unforgettable thoughts, but feeling it will be there into the unconsciousness. When you grown up, you can't able to recall it in a proper way. Then projection, what will happen, attributing the one's own unacceptable thought or a feeling to the someone else. So if whatever you have done, so you are going to blame on the others, but still you have done that particular problem. Next one is a rationalization. Here what will happen, justifying the behavior or feelings with the logical reasoning, often avoiding the true reasons. For example, a student who fail in the test might be saying that I didn't study because the teacher does not like me anyway, instead of acknowledging their lack of the preparation. So this is what we are going to do, the some psychological strategies to cope up with the particular anxiety, or it may be some loss or emotional pain it is happen. So this is about the defense mechanism. Hope you understood the session. In this session mainly we have discussed about the important and the repeated question they have asked in the main exam. For more interesting videos, keep follow with the Ezinurse. Thank you.